Welcome everyone to today's webinar, Proactive Patient Engagement, where the revenue cycle starts and better outcomes begin. I'm Morgan Hafner with Becker's Hospital Review. We'll begin today's webinar with a presentation, and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. We are looking forward to hearing your questions. In today's session, we're going to be recording and will be available after the event. You can use the same link you used to log into today's webinar to access that recording. At this time, I am pleased to introduce our presenters for today's webinar. Teresa Moss is a Solution Marketing Manager at Interlace Health. Teresa has a background in hospital outpatient radiology and operations management. In her spare time, she enjoys cooking, gardening, and barbell training. Ann Hill is a solution architect at Interlace Health. Ann has 25+ years of experience designing healthcare solutions to solve complex clinical and administrative workflow challenges. She lives south of Boston with her husband and 3 children and enjoys boating, paddleboarding, and spending time at the beach. At this time, I am pleased to turn the floor over to Teresa to begin today's presentation.
Thank you so much. So again, my name's Teresa, and I'm really glad to be able to spend some time with you today talking about pre-registration and how it can help address some of the challenges we have around hospital registration and see how it can help positively impact revenue cycle management, operational efficiency, and patient engagement. So before I get started, I want to really quickly talk about what I mean when I talk about registration. When I talk about registration, I'm talking about a process by which a patient is entered into a hospital's record. It's when the medical record is generated and it establishes a financial account for things like charge capture, coding, documentation, claims processing, and then all payment collection and account resolution follow-up after that. And at the moment of registration, when we register a patient in our system, it's the first time that we capture information that's going to eventually appear on a claim. So let's take a minute and talk about some of the challenges that we face around registration. A really big challenge is registration accuracy. And one reason why we have so many registration errors is because depending on your workflow, there are a number of other processes that frequently occur at the same time as registration. There are some revenue cycle related activities we ask our registrars to perform, like checking eligibility or performing financial counseling, delivering estimates, collecting co-pays, all of that kind of stuff. We may also ask them to participate in the collection of clinical information. And so this usually takes the form of handing out a clipboard with a stack of paperwork on it. And the paperwork might be asking for health history, medication, allergies, screening form specialty specific, depending on their visit, authorizations to release protected health information, to request outside records, that kind of stuff. But also, we got to do a lot of really difficult things up front sometimes too, in between registering all those patients. Like maybe we need to dress and room the patients. Maybe we need to assist the clinical staff in our areas. We might be asked to answer the phones or schedule appointments. And frequently we're getting asked up front to do things like help with a coffee machine or hand out cheaters or any number of other things to distract us and interrupt our work. And denials are a really big pain point for our hospital systems. 76% of hospital leaders are citing denials as the biggest challenge within RCM. And the #1 cause of denials is missing or incorrect information. So registration errors really contribute to that. Another problem we have around registration is the existence of bottlenecks there. So the advisory board sets a best practice benchmark of 35 registrations per registrar per 8-hour shift, and that works out to be less than 14 minutes per registration. And so you end up in a situation where you need to process a lot of patients without having lots and lots of staff. And so you may end up with too many patients with too little staff and not enough time, and so registration becomes your bottleneck. You can't expand your schedule anymore because people can't get past the registration desk fast enough. And, the registration staff is under a lot of pressure as well. Registrars are struggling to keep up with the patient load and maintain accuracy. And it can be a very high pressure, overwhelming environment. It can be very chaotic for them. Patients also are not in love with our current registration processes. I've seen reports where patients they talk about feeling like they are just a number, that they are being herded through like cattle, that they have really long wait times. Patients get very frustrated with the wait ahead of seeing their clinician. And they can begin to see registration as simply a barrier to accessing their care. And when you couple that with a busy and stressed out registrar, you end up with an unengaged patient. And then clinicians are also frustrated with the process. They're only alerted sometimes to the patient safety concerns when they filled out their paperwork right ahead of their appointment. And so it can lead to a lot of last-minute surprises and changes and alterations to their schedules and near misses and that kind of thing. And so everyone's really frustrated by this unpleasant process often. One of the tools that we theoretically have to help address this problem is the EHR patient portal. The patient portal is very useful, but it can really present some challenges in a pre-reg process. So often the patient portal doesn't offer the ability to customize forms basically for your practice. Or if it can, it's difficult enough that it's sometimes not worth doing. And so I have personally registered at a place where I registered on a portal and then was still handed paper forms when I walked in. The EHR patient portal's intake process may not play well with your existing workflows. And so you may end up seeing staff asking patients to not use the portal because it just doesn't work with their established processes. And the patient portals often really struggle to handle new patients who are unknown to your practice. And some require a patient has come in to see you first before they can be given access to create an account with the portal. And so you're missing out on this process being extended to that segment of your patient population who's seeing you for the first time. All of these challenges really, they end up affecting your bottom line. So you're getting claims denials from a process that doesn't support registration accuracy. You're having issues with your staff who are maybe not comfortable asking for co-pays at the time of registration, and so they may skip that question and not take in payment. You're dealing with last-minute schedule changes, and we all know when your schedule changes at the last minute, you've lost any opportunity to recoup your reimbursement from that schedule slot, right? So if that change happens right before the appointment's supposed to occur, you're just out whatever money you might have collected based on that appointment slot. And there's some risk to patient safety, right? You're asking your staff to take a very short amount of time to review the patient's submitted health information and make sure they identify every problem. I know that right now we're all really sensitive to touching clipboards and pens and all kinds of shared surfaces, and so it's just kind of an icky process for them as well, right? All of these things end up adding up to lost revenue for your system. And it can be a big challenge and a big hurdle to overcome. Now we at Interlace, we really think that pre-registration is a big help for all these problems. And I have here a little graphic that kind of talks about some of the activities happening around registration in a typical health system. And that's collecting clinical paperwork, entering demographic information, collecting copays, entering claim-related information, insurance information, and getting consent signed. And I've noted here with my colors on my bubbles which activities are led by the patient, and those are the green bubbles. And then which activities are led by your staff, and those are the purple bubbles. And as we sat and thought about these activities and thought, what could we get done ahead of the data service? I can kind of show you how all this sorts out. So you'll see that actually the vast majority of these activities could be happening ahead of the date or time of service. And if you can take those activities and really push them to the patient at home and allow them to complete these activities on their mobile device, you're turning a lot of these activities from staff-led processes to patient-led processes. So you can see how that would really lighten the load on your staff when the patient does come in for their appointment. So pre-registering your patients in a mobile-friendly format really has beneficial effects on patient engagement. You know, an invitation to complete the pre-registration steps can serve as an appointment reminder to make sure that your patient comes in for their appointment. And patients who have completed pre-registration steps, completed their paperwork ahead of time, they are just more likely to attend the visit. So they've already engaged in the process well before showing up at your facility, and they're more likely to take that last step because they know there's less of a barrier and hurdle to their care when they do arrive in your facility. When your staff is less overwhelmed and overloaded, your patients are going to find them more engaging, and it creates a positive impression about your practice that carries through their impression of the clinician in the practice as well. And of course, getting this information ahead of time, it's going to positively impact your operational efficiency too. So a smoother pre-authorization process means insurance card images can be available to your staff ahead of the data service. So I know how much of a help it would have been for me to be able to look at an insurance card and find network status or find the provider line number on a patient's particular card. There's going to be a reduction in in-clinic wait time because a lot of these activities can be handled before the appointment, so the patient doesn't have to arrive quite as early. They're not going to be lingering in your waiting room, and there'll be fewer bottlenecks in registration as well. There's generally less paper shuffling, paper scanning, paper following a patient around your facility during their visit. Pre-registration does have a very positive impact on patient safety. So if your staff could view all of this clinical paperwork ahead of time and know about red flags ahead of time, it would give them the opportunity to make schedule adjustments as needed, not at that last minute stressful moment, but maybe well enough ahead of time that you can easily accommodate your patient and refill that slot. If you can get an authorization to release PHI, it can make it easier for you to obtain outside records ahead of the appointment and have them in the facility when the patient comes for their appointment. You'll find that there's increased compliance if you can make sure that all documents are going to be electronically sent over to the medical record so that all of your consents and your paperwork are where they're supposed to be when they're supposed to be there. And your departments and clinics would run more smoothly. There's less stress on the care team. There are a number of really great impacts to the revenue cycle if you push a lot of these processes to the patient in their home via mobile format. You're able to maximize your schedule more, again, because you're going to have fewer last-minute reschedules. There's increased registration accuracy and efficiency, and then there's going to be a big increase in pre-service collections. So I have observed myself in a clinic where staff are having to actually ask for co-insurance and deductible as opposed to co-pays, and a lot of times these deductibles these days are very, very large, and so these staff members don't feel comfortable asking for large deductible payments from patients before they are allowed to be seen. And we observed that frequently that question is just skipped during registration. And the staff is thinking, they'll collect the money after the appointment. But we all know that can be a real challenge. And so software that asks for payment ahead of the data service, it's not shy, right? And it's always going to ask. So you get an increase in your pre-service collections. And then all of these tasks happening ahead of the date of service, they help them in the back end too, right, in your back office. So accounts spend less time in AR if you collect it up front. And it's more easy to follow up on outstanding balances when you have a direct line communication with the patient established already and you've had an opportunity to ask them to do something like put a credit card on file. Now I want to specifically talk about Interlace Health's pre-registration solution. Here are some of the key features. I'm going to go over them kind of quickly because Anne is going to give a wonderful in-depth demonstration at the end of my talk. So Interlace's solution offers a mobile-friendly intake process. It can be completed by patients on their own devices, which I am certainly more comfortable with my own device than in a strange, unknown device to me. Our process can easily handle new patients. So even if they're not established in your portal, they can use our solution just as easily as a returning patient can. Our solution uses logic to take information that you give us about the appointment, maybe about the provider or about the patient, and logically select the correct forms and tasks for that patient. So patient is receiving a tailored list of items that they need to complete, and it is customized for them for their appointment, and so patients enjoy that level of customization as well. Our solution allows image capture to do things like take pictures of insurance cards, of driver's license, or doctor's orders, so that you don't have to deal with the patient forgetting to bring their order with them to their visit. And we support payment processing as well. We either can use your payment processing vendor if you have one already in place, or recommend one of our own who can help you get set up for taking payment ahead of the data service. We allow the patient to complete all kinds of steps ahead of the service, not just filling out forms, but maybe visiting a website or watching a video about a procedure they might be having. And we give the staff a flexible dashboard that allows them to monitor the progress, both the progress of the patient filling out the paperwork, as well as alerting them to any concerning information the patient might have shared when they filled out the paperwork. We offer discrete data integration to your EHR, and we also send the information we collect from the patient in a traditional format, right? The 8.5 by 11 looking form, it can be sent digitally to your EHR as well, so that the form that the staff is seeing looks very familiar to them, and all the information is where they're expecting it to be on the form as well. And we partner all of that with really a very robust service offering. So we have great services. We have people who are able to help you with your form designing if you need, and help maintain your forms library if you need, as well as terrific support. And with that, I'm going to hand it over to my colleague, Anne Hill, and she's going to do a solution overview.
Great, thank you, Teresa. As mentioned, my name is Anne Hill. I am a solution architect with Interlace Health. And during today's conversation, I hope to show you how our pre-registration solution complements your existing EMR environment. Leveraging Interlace Health's form and electronic signature capabilities outside of the hospital walls allows your staff to gather patient information ahead of the date of service and realize all of those benefits that Teresa just outlined. So my patient, Mr. Allard here, is scheduled for an MRI appointment over the telephone. Among the pieces of information collected at the time of scheduling is his email address. And, you know, that scheduler might take the opportunity and inform Mr. Allard that an email will be sent with a link to complete forms prior to his appointment, and might even explain the benefits of completing those forms ahead of the day of service, and really encourage the patient to click that link and complete the forms. That scheduled appointment automatically triggers an email with a link that includes the correct forms for that specific appointment, for that specific patient, that would be presented to the patient when the site is accessed from the email link. So then at a time that is convenient for him, Mr. Allard would access the email as you see here. This is just a sample email. And all accessing that link, he would be presented with a login screen. I am showing you today the view from a smartphone, understanding that for the majority of cases, patients who are submitting information outside of the hospital walls will likely be on some sort of a mobile device. If this was Mr. Allard's first time logging into the site, he would have been prompted to validate that it is indeed him entering the system, typically something like an email plus date of birth, the last 4 digits of social security number, etc. So when Mr. Allard logs in, he would be presented with a welcome screen, welcoming him to access his checklist. So Mr. Allard has an upcoming MRI exam, and several pre-registration items are waiting for him to complete. Items that you see here can either require input from the patient, such as a form or questionnaire, or could be reminders or informational type of items, such as directions or a parking map, or even a link to a short video like you see on the bottom here. And the due dates of the items that you see here are automatically defined in relation to the date of the exam. Loading the MRI exam history form, you will see a type of form built specifically for our pre-registration platform and really optimized toward a mobile solution. So instead of presenting, an entire 8.5 by 11-inch form on a mobile device, which wouldn't be very easy for the patient to navigate, we allow the data to be chunked out in a way that's easily digestible by the patient, really making for a positive, intuitive customer experience. And as Teresa mentioned, when completed, the data collected on this type of form is automatically mapped back to that standard 8.5 by 11 type of form for archival. Because Mr. Allard is an existing patient, notice that his information, some of his information is defaulting in from the EMR via an ADT HL7 message that is just feeding through a server. So any types of information that flows through that ADT HL7 message is available to be pre-defaulted onto a form, really streamlining the form completion process for the patient. Moving on to the document, patients can answer simple yes and no questions by toggling some buttons here. And if you look down at the diabetes question, if Mr. Allard doesn't have diabetes, there's no need to ask him additional questions about his diabetes, right? However, if he answers, yes, I do have diabetes, notice that additional questions are presented to the patient. So, on paper, there are likely many fields included on a, form or questionnaire that just don't pertain to the patient. With an electronic solution, patients no longer have to be presented with all those, all that noise that may not apply to them, but instead, the data input can really be streamlined using conditional logic to only present relevant questions to the patient. Moving through the document, additional questions about the MRI procedure. I'm just using the next button on the bottom here to navigate through the form. And notice the bottom question here. Do you have any objects or devices in your body that you were not born with? Notice that Mr. Allard has stated that he has a pin in his left knee, and I'll show you where that comes into play in a bit. Also, when a patient is completing a form on a mobile device, the system is requiring that the patient scroll to the bottom of the page before proceeding to the next page. So you can really dictate the patient reading the entirety of each page before proceeding to the next page. And then, when it comes to sign and apply a signature to the document, I'm saying here that Mr. Allard is in fact the one completing, the one signing the document. So I was asked to type in my name, and then I'll just click here to sign. And then using finger stylus, really depending on the type of device that the patient is completing the form on. If patient was on a home computer or desktop computer that did not have touch screen, they could always change to a typed signature. But if they are on a type of device that accepts touch screen, then they could sign using finger stylus, whatever. And now that signature, along with a date and timestamp, is automatically applied to the document. And patient would be brought back to their care steps, their checklist here, and notice that the form that I just completed becomes low lit, drops to the bottom of my list here, signaling to the patient that that item has been completed. And I'll show you in a minute what that might look like on the back end. Next, let's look at that insurance card image upload. So patients have the ability to capture digital images. Most popular use case here is insurance card, right? So the patient can leverage the camera option of their mobile device to take a picture of, insurance card, driver's license, even, their pill bottle, the label on their pill bottle. Really, so many use cases for the ability to capture a digital image. And again, depending on the type of device that the patient is on would determine how that image is captured. If they are on a mobile device with a camera, they can leverage the camera. If they were not on a mobile, a camera-enabled device, the patient could always browse out to their device to find an image that might have been previously saved. So I'll just click here to take a picture. Patient can choose the take photo option, take a picture of the front of their insurance card. I'll say I'll use that. And now that insurance, that image is now attached to the document and sent along as a digital image for staff to review prior to day of service. So now not only does the registration folks have some important information about the patient prior to arrival, they also have an image of the front and back of the patient's insurance card, allowing them to, maybe start that pre-auth process and kick off that revenue cycle much earlier than, patient standing in front of them. Switching gears a little bit to the staff experience. Administrative dashboards, which you're looking at a sample here, are customizable and can be configured according to the needs of your users or groups of users. Not sure if this was mentioned earlier, but this particular solution sits on top of Salesforce. We have partnered with Salesforce, so really can take advantage of their sophisticated dashboard reporting capabilities. Here you're viewing a dashboard that has been configured to look at care event or appointment scheduled for next week. In reality, your folks, depending on how busy they are, might look at what do I have today or what do I have coming up for tomorrow. In this particular dashboard, again, these are highly customizable. Users can see the patient's name, the name of the appointment, when it is scheduled for, some alerts there. registration status, provider, etc. I'll call your attention here to the form alerts. Remember when Mr. Allard was completing his MRI paperwork, he mentioned that he had a pin in his left knee. The act of answering that question in such a way has triggered an alert to the staff dashboard. So your staff or you can set up alerts so that your staff can be triggered to information that you may find really, really important to know prior to the patient arriving for data service. I just use the example of patient has metal in their body. Gosh, it would be nice to know that before they show up. You know, you may need to reschedule that piece of equipment. You may need to reschedule Mr. Allard for a different piece of equipment. Staff can dive into the actual care event, the actual appointment. And notice from here, I can easily see the status of the different items that we have asked Mr. Allard to complete. I can see that, yes, he uploaded his insurance card. Yes, he completed his MRI and exam history form. He has not started his patient consent and authorization form, and he did not view the video. And we've color-coded these to make them visually easy for your staff to take a quick look and see where Mr. Allard is in the process of completing the forms that were sent to him electronically. That right there is the, you know, when you drill down is the view into the form alert. So form alerts can be bubbled up to the top of a dashboard, as I showed you earlier with that form alert icon. And in addition, you can include additional text or explanation within the view you're looking at here. Notice there is an option on that MRI history exam form that I just walked you through to go ahead and view what that looks like. So as I mentioned earlier, both Teresa and I mentioned, patient view is, you know, easily chunked out data walking you through, you know, really optimized for mobile device. But all that data is mapped back to a standard looking form like you see here, and all the data is filled out on this form. And this is what would also be digitally transmitted to the EHR in the patient's record. One more thing. So let's say the patient shows up for the appointment. Your staff go look at the dashboard. Oh, Mr. Allard, you did so great. You filled out 2 of the items. You didn't fill out, you know, the last 2. You might not worry about the video, but you didn't fill out your consent form. So Mr. Allard is standing, you know, in front of the staff, and you have a couple options here. You have the option to say, hey, Mr. Allard, you know, do you have your mobile device on you? You know, do you have access to email on your mobile device? And if Mr. Allard says yes, you can say, great, can you go, you know, sit down, pull up that email and complete those forms, and then come on back up when you're done. Another option you have, if you call your attention to the upper right-hand corner where it says patient QR code, you also have the option to generate a QR code right to the dashboard. And what this allows your staff to do is one of 2 things here. You can, you know, if you have a inventory of iPads at of facility-owned iPads, you can grab one of the iPads, scan the barcode, which would bring that iPad directly to that checklist, hand the device to Mr. Allard. Mr. Allard can go sit down, complete the forms, bring the iPad back up, and now he's, you know, ready to move on to his appointment. Or you can scan with patient's device again if you need to bypass the email for some reason, and same view would load onto the patient's device as well. But just to reiterate, there are a couple options when patient shows up on day of service and all their forms have not been yet submitted. I think we hear that BYOD, bring your own device, is really preferred. You know, if you can keep your patients on their own device, even when they get, to your facility, that's probably optimal, but you do have opportunity to, use facility-owned devices and queue up what needs to be completed on that device and hand the device to the patient for completion. And that was my overview of the pre-registration tool.
Thank you so much, Teresa and Anne, for that fantastic presentation. We're now going to begin today's question and answer session. So please submit any questions you have by typing them into the Q&A box you see on your dashboard. We'll try to get through as many questions as we have time for today. And Teresa and Anne, there's a lot of great engagement from audience members today, and in particular, someone is curious if a patient isn't technically savvy at all, sort of what to do in that situation. Is there an alternative manner of getting pre-registration information completed before their visit?
So I'll take that one. This is Teresa. First of all, I think it's important to know that, even though we have a concept in our mind that people like maybe the elderly are not as technically savvy, they're getting more and more technically savvy. Something like 95% of people age like 65 to 69 have a cell phone now, right? And, over 40% of people in that age range own a tablet. And so I think there's a much wider level of comfort than you might suspect. I've worked with 2 facilities who implemented tablet-based registrations, and they did not have anywhere near the challenge they thought they would with people saying, I don't know how to use a tablet. It's pretty standard stuff. However, if your population is such that you feel there might be a large portion who cannot go through an online pre-registration process like this, we have the ability to completely customize that initial email inviting them to complete their process. And you could say something like, if you would prefer, give us a call to complete your pre-registration steps verbally. And then, of course, you can always use paper as a backup for people who can't be reached in other ways. This could, though, really address a large portion of your patient population.
That's a really great perspective. Thanks so much for sharing that, Teresa. And there's another question about payments. And an audience member is curious, are you able with this platform to make payments online?
Yes. So we are able to, again, do one of 2 things. Either partner with your payment processor if you already have one. Most of them have, the ability to make available an API that allows us to kind of integrate that payment collection into this process. Or if you don't have one that is compatible, we actually have a partner that we can use to collect that payment and make sure it gets then to your payment processor. So we facilitate that in a couple ways. That's a really important part of this solution. And so yes, we facilitate payments online.
Great. Thanks so much, Teresa, for explaining that. An audience member is curious about MRIs in particular. They're wondering, are there questions for MRIs about use of portable oxygen in this platform?
So let me explain that. And I think the best way to put it is, if you have a question about portable oxygen on your forms, we will present it to the patient. And so it's something a little unique about our solution. We don't have canned forms that we ask you to use. We take your form as it exists today, or however you have it approved, and we convert that form into a mobile-friendly format. And so, we're able to accommodate any special information you're collecting today, any preferred questions that maybe your radiologists have decided are really important. I've worked with a lot of doctors, and I think I've worked with many, many different opinions about what belongs on the paperwork, and I understand the challenge around that. And so one of the really great things about our solution is we will include whatever questions you want on the forms.
That's really helpful for understanding. There's a follow-up question about payment. An audience member is curious, how do you handle on-premise payments?
That's a really great question. So this process that we showed happening on a cell phone, and with the presumption that it was a patient's cell phone, that exact same process, that intake process, can be handled on a facility-owned tablet. So you could have a situation where a patient hasn't pre-registered at all, and they show up for their appointment, and they need to pre-register, or they need to register in your lobby, in your waiting area. We make it easy to transfer that registration process to a tablet that is owned by the facility, and then hand that over to the patient, and then they can complete all the exact same steps that they could have completed at home, complete those in your lobby. So the process is really the same. We facilitate it in either area, the patient's home or in the waiting area.
That makes sense. Thanks for explaining that process a little bit more. And for audience members, I really welcome you to keep submitting questions, and there's a lot of great ones coming in. Another audience member is curious more about how this integration works with EMRs. So how does this system integrate into EMRs that are pre-existing, such as Cerner and Epic?
Yeah, that's a terrific question. So we have a number of options. First of all, we have the ability to send in discrete data. We found some customers enjoy the ability to take in the data that the patient enters, but they want it to be reviewed by staff before committing those changes to the EHR, which is very understandable. We have other customers that say, nah, the patient knows their address, and so we'll just ingest that into our EHR. So we have been able to push discrete data in both ways to the EHRs like Cerner and Epic. We also are able to use a format called CCD, or I hear people call it CDA as well, which is a continuity of care document that EHRs are good at ingesting already. We can send the information collected from the patient through that method. And so it depends on your workflow. Some facilities already have a workflow where they have staff working through these continuity of care documents. But we have both of those options, and then as well, we can send that image of the form that we've populated with the patient's answer as well to EHRs, just like Cerner and Epic.
Got it. Thanks so much for explaining that. An audience member is curious about EOBs. Do patients have the option to access explanation of benefits related to their bills?
So the patient will have access to any information that that the hospital system is able to send to us. So if we're working with a customer right now where we're serving, they're really thinking of it more as an estimate, right? Where they're talking about what procedures the patient's having and how much each of those procedures cost, which is kind of an EOB, although we're not prospectively saying what the insurance is going to do or not do. But because they're able to send us the information, like the exam type and the cost for each exam, we can present that to the patient in the same format so that they can understand, why they're being asked to pay, what their options are for payment plans and that kind of thing. And so yeah, we can serve them any information that we're able to get from the customer.
Got it. And this next question is about workforce. The audience member is curious, does the solution reduce the need of schedulers and registrars?
That's a great question. So I can tell you that we have seen a reduction in registration time on average of 50 to 60%. If you are accommodating all your volume and are happy with that, you could reduce your schedulers and registrars' hours because you don't need to have them spending as long with each patient that you're trying to see. Alternatively, you could accommodate more volume with the same amount of staff. There's really a savings either way. It just depends on the needs of your health system.
So it will depend on your specific needs. Another person is curious, what role does Salesforce play in the examples that you shared?
That's an awesome question. So we partner with Salesforce to deliver this solution. Salesforce is kind of hosting the cloud portion of the solution. So the dashboard that your staff would monitor that Anne showed, that is a part of our Salesforce portion of our solution. And they do things like handle the automated emails and other automated contacts with your patients. And so that's all built on Salesforce.
Great, thanks, Teresa, and thanks so much for that excellent question. A reminder to anyone who has a question for Teresa or Anne to please submit it in the Q&A box. It's been a really great discussion so far. The next audience question is about culture and language. They're curious if the mobile device has cultural and language-friendly capabilities.
Sure. So, of course, we support any kind of mobile device. So that is sort of up to the user or the facility. But if you're wanting to have multi-language support in the forms that you send out, we do support special characters. Right now, we are supporting Spanish, and I believe we're working on getting Mandarin going as well. And adding support for other special characters and support for other languages is on our roadmap. So if you have a specific language need, that is something we could work with you to get provided by the time you would go live if you wanted to partner with us for the solution.
Great. Thank you. And just looking at the next question from the audience, it's related back to EHRs. They're curious, is staff able to review the information patients have entered before it's added to the EHR?
Yeah, so we support that ability. So different EHRs will work in different ways, but one really great way to accomplish this is by sending the information the patient has submitted through that continuity of care document and use that workflow. So EHRs are already really great at ingesting that format. And so usually what we see is that staff in a facility works a queue basically of incoming CCD documents and then can accept or reject the information in them before it's committed to their EHR. And so we could use that same workflow for this patient submitted information as well.
Got it. Thanks so much for breaking that down a little bit more for us. Back to payments, an audience member is curious, does the system provide auto bank reconciliation while online payments are integrated with bank records in your system?
That's a great question. So I would say that that kind of reconciliation is going to be handled by the payment processor. So either if you have a payment processor or if you want to use the payment processor partner that we have, they would be in charge of things like reconciliation. If you needed to see information about that, it's going to be different probably depending on which particular payment processor solution you're using.
Okay, that makes sense. And another person is curious about cancellations when it comes to appointments. So if a patient wants to cancel their upcoming appointment, can he or she do so through the platform?
So as of right now, we're not hooked in with self-scheduling or self-cancellation solutions, although that is on our roadmap of things we'd like to do and add to this solution. We could, if the customer would like, we could add an ability for the patient to contact either a phone number or to send a message that would show up on that same Salesforce dashboard that the patient could contact in that way.
Excellent. Well, Teresa, and to everyone in the audience and Anne as well, it's just been a fantastic discussion. Love seeing all the questions come in, so thank you so much for your participation there. Sadly, that is all the time that we have for today. But I want to send a big thank you out to Teresa and Anne again for their excellent presentation, and to Interlace Health for sponsoring today's webinar. Please enjoy the rest of your day, and we look forward to having you join us for future webinars.